Pregnancy is a time of joy and anticipation for many, but sometimes there can be complications. One such complication is an ectopic pregnancy. This is when a fertilized egg implants outside the uterus, most often in the fallopian tube. Ectopic pregnancies are not as common as normal pregnancies. However, they are serious and require immediate medical attention. Understanding this condition is crucial for women of childbearing age. It's important to know the causes, symptoms, and treatment options. An ectopic pregnancy cannot proceed like a normal pregnancy. The fertilized egg cannot survive outside the uterus. Furthermore, the growing tissue can cause the fallopian tube to rupture. This can lead to internal bleeding, which is life-threatening. Early diagnosis and treatment are vital in managing ectopic pregnancies. Recognizing the symptoms and seeking prompt medical help can be life-saving. Several factors can increase the risk of an ectopic pregnancy. One of the most common is damage to the fallopian tubes. This can be due to infections, previous surgery, or conditions like endometriosis. Smoking, a history of pelvic inflammatory disease, and certain fertility treatments can also increase the risk. Understanding these risk factors can help women take preventive measures and seek early medical advice if needed. Recognizing the symptoms. The symptoms of an ectopic pregnancy can vary. Some women experience no symptoms in the early stages. However, as the condition progresses, common signs include abdominal pain, vaginal bleeding, and shoulder pain. It's crucial to remember that these symptoms can also indicate other health issues. Therefore, it's essential to consult a healthcare professional for an accurate diagnosis. Early detection is key to preventing serious complications. Risks and complications. An untreated ectopic pregnancy can have severe consequences. As the fertilized egg grows, it can cause the fallopian tube to rupture, leading to internal bleeding. This is a life-threatening situation and requires emergency surgery. Even if the fallopian tube doesn't rupture, an ectopic pregnancy can cause scarring. This can increase the risk of future ectopic pregnancies and infertility. Diagnosis and treatment. Diagnosing an ectopic pregnancy involves a pelvic exam, ultrasound, and blood tests. The ultrasound helps visualize the location of the pregnancy. Blood tests measure the levels of pregnancy hormones, which can be abnormal in an ectopic pregnancy. Treatment options depend on the stage of the ectopic pregnancy and the woman's overall health. Medications can stop the growth of the ectopic tissue. In some cases, surgery may be necessary to remove the ectopic pregnancy and repair or remove the affected fallopian tube. Hope and support. Experiencing an ectopic pregnancy can be emotionally challenging. It's important to remember that it's not your fault. With the right medical care and support, most women who have an ectopic pregnancy can go on to have healthy pregnancies in the future. Seeking emotional support from loved ones, support groups, or therapists can be incredibly beneficial during this time. Remember, you are not alone. With time, healing, and support, you can look forward to a brighter future. Subscribe to our channel for more intriguing content on health and wellness.